Hello and welcome to Unstress, where we explore what stresses us as individuals and the planet. As you all know, the two are inseparable. This is Dr Ron Ehrlich. We've covered issues surrounding women's health, and I believe that's actually relevant to men as much as women, because as you're a man, there's a very good chance there will be some significant female in your life, partner, mother, sister, daughter, family or friend. So gaining an understanding of women's health is important to understand each other better. A worthy goal if ever there was one. Children's health is interesting too, even if you don't have kids, because kids are really the canaries in the coal mine, and things are not looking that good. So today, the subject is men's health, and of course for women out there, stay tuned for all the reasons we wanted men focused on the subject of women's health. Just filling in the pieces of the puzzle here. Men aren't always as focused on their health as they should be, and certainly not as focused as women are. But needless to say, it's very important, and it might actually be one reason why women live a longer life. Maybe it's a function of that focus on health. My guest today is Dr. Rob King, an integrative men's health physician who, as you will hear, delivers innovative and effective treatment approaches for some common and not so common health issues, as well as, and importantly, involved with the disease prevention strategies. Now, it's interesting because Rob is an integrative practitioner, and yes, this is a recurring theme and is a common denominator in many of my guests. Why? Because as an integrative practitioner, as much as possible, they look for and then treat the cause of a health problem rather than suppress a particular symptom. And that can have far-reaching effects on other health problems within the same person. Thinking holistically, the cause is often multifactorial, with biochemistry, nutrition, microbiology, psychology, all playing important roles. He also integrates the central role of the gut, another recurring theme, on a whole range of common conditions and diseases, and men's health is no different, some of which today was news to me, I must admit. We cover quite a bit of territory here, some things I was entirely unfamiliar with, and others that have affected me personally. I hope you enjoy this conversation I had with Dr. Rob King. Welcome to the show, Rob.
Thank you very much, Ron.
Now, Rob, men's health. As a man, and knowing many men, we don't often give as much thought to it as we should. What are some of the things that come into your practice that distinguish... Tell us about your practice, first of all, and how you got into this.
Mm-hmm. Okay, so I started my training in sexual medicine, and during my training I found out about this new specialty. So this happened about 15 years ago, of men's health. So it's already interesting to note that we've always talked about women's health for a very long time, and yet men's health had been largely ignored. So this new specialty that was really driven from Europe, actually, was to include all the aspects of health that are unique to men. So that is sexual dysfunction, absolutely, very important. Prostate health, again, which is a very largely ignored problem, and also andrology, so everything to do with male hormones. So currently, if you have a problem in any one of those areas, or in all three of those areas, you'd actually have to see three different specialists. So the idea was to bring those three men's health issues under the one specialty. So that's what really men's health is. And so I thought that was a very interesting, really interesting specialty to work in. And basically, I took that a step further by taking it to a degree of what we call integrative medicine. So actually not just looking at those three subspecialties, but also putting in the greater context of the man's health.
Yeah.
So my practice today is very much revolves around comprehensive health checks for men. So that would involve include men who would come to me because they're well and they want to stay well. And I am seeing younger and younger men who come for that. So even I have a few patients in their 20s now who come for an annual or biannual every 2 yearly health check. And I see some older men who've already got some health issues, and they find they're not getting necessarily any answers elsewhere. So that I'd call that more health assessment. So trying to improve their health, and that's really the two broad categories of men I see for health.
And what with those older men? Because I think it's interesting to see where they're at, because then we can go back and tell our younger men how to avoid some of the problems that the older men are facing. What are some of those common problems that older men are facing? And by older, are we talking about what age group? And be careful how you answer this, Rob.
Yes, exactly. So really generally 40 and older. However, I'm seeing health problems in younger and younger men. So it's even coming down to 35. Really, we can actually start talking about older men. And we know that the aging process actually does start around the age of 35. So if you're actually not looking after yourself, you will accelerate the aging process, which then really takes off in one's 40s. Okay? Right. So basically, some of the important issues that I see a lot of men who have who come to me for low libido. So that may not be in the context of a health check, by the way. So the other, so they may come to me for specifically low libido. I see a lot of sexual dysfunction, such as erection difficulties, some premature ejaculation, which is also very common. Also, another condition that I treat actually is something called Peyronie's disease, which is very common, there's not much awareness of that condition. It's a scarring process that occurs in the penis that leads to curvature of the penis. So that's also something I see quite a lot of in my practice. Now, the other issue is men having urinary difficulties. So this is when we come to talking about the prostate. So from about the age of 35, the prostate, depending particularly if you're overweight, the prostate will start enlarging. And by the age of 40, some men will start noticing a change in their urine flow, that they'll be going to urinate more frequently, that they may start getting up at night to urinate more frequently. So that's also something I see a lot of.
Peyronie's is something I've not, I mean, obviously we've heard of the beer, but Peyronie's, I've not actually heard of that. Tell us we'll kind of come back to those other ones too, but you mentioned Peyronie's and I've not heard of that.
So that's very interesting because it's actually quite common. So probably even up to about 10% of men will have Peyronie's disease during their life. So what it is, it's as I said, some scar tissue that forms in the penis and then can start contracting and then causes a curvature. Now the causes of that can be trauma, say during sex. Diabetes is a very well recognized risk factor, and it can vary from a slight curvature. Generally, it's an upward curvature anywhere in the shaft of the penis, the mid shaft or the distal shaft, and sometimes it can be so severe that from a already appearance perspective can be very distressing for men, but also it can also interfere with intercourse. So and it can be painful at the beginning when the process actually starts. Some men actually wake up one morning, and that's why it's a very unusual condition, because it's as if the scarring and the contraction of the scar tissue can happen very rapidly. And some men will say, well, I woke up one morning and suddenly looked at my erect penis with my morning erection, and there was this curvature. Wow. And it's very interesting that you haven't heard about it, because I always say to everyone, we need to raise the awareness of Peyronie's disease, because the treatment is also very difficult. Now it can be corrected surgically. In my practice, I'm currently using Shockwave Therapy to address that scar tissue. Now, the scar tissue usually forms in a nodule or a plaque, as I said, most commonly on the dorsum of the penis, so you get an upward curvature, but sometimes also downward or sideways, or sometimes a combination of those. So
it's mind-boggling.
It is.
This is 10%? This affecting 10%?
Up to 10 in a man's, yes, overall. That's right.
Wow. And I mean, the trauma, to wake up like that must involve some form of trauma to the penis, which is kind of overactivity.
in one form or another?
Look, it may be, although most men that I've seen in the last 12 months have not, and that's also well documented that there's no obvious trigger for it. Okay, so I was going to say a lot of men, in some men, about a third of men, it actually resolves spontaneously, which is also interesting, which is why those men may never report the fact they've had it, because they prefer not remembering that they've had it.
Yeah.
And about a third of men, it will stay, rather, stable from the day they first notice it, and other men will actually start, actually worsen over a matter of weeks to months.
And dare I ask, shockwave therapy sounds quite dramatic and almost, is that done under local anaesthetic, general anaesthetic?
Okay,
just sitting in the chair. I'm cringing when I think of this, but go on.
Good question, because shockwave therapy also is very effective for men with erection difficulties as well, because what it can do and what is, as far as the scar tissue is concerned for Peyronie's disease, we know that it helps the body or the immune cells and to actually break down the scar tissue and relay a normal tissue, or actually remove that scar tissue, but also make sure the tissue around it is normal. But it's also very effective in men with erection difficulties because we know that it can also trigger the generation of new small blood vessels in the penis, and it probably also has a regenerating effect on what we call the cavernosal tissue, which is the part of the penis that engorges with blood. So to come back to your question about pain, that's an interesting one, because we actually set it at a level where it's uncomfortable but not painful, and it's a hand piece which is held up against the penis. So in the situation of Peyronie's disease, up against the scar tissue, the area where you've got that fibrotic scar tissue nodule or plaque, and I apply about, really depends, up to 10,000 impulses. The treatment might take half an hour to 40 minutes. And some men tolerate it very well, and some men don't tolerate it very well. So it's interesting you should ask me about some form of anesthesia, because one patient was tolerating the treatment so poorly that actually we did a trial of applying some topical anesthetic, so lignocaine in particular, and in fact, it made the pain even worse, as if numbing the skin somehow enhanced the pain response in the deeper, the deeper nerve endings. So hence why, if you read up on all the studies, there's never any mention about using a topical anesthetic. So that's shockwave therapy. Now, again, for erectile dysfunction, particularly in diabetic men, it works really well. And of course, there's many causes of erection difficulties, and you try and actually address those first. I don't just, see a man present to me with erection difficulties and just put them on shockwave therapy. That tends to be the last actually line of treatment. Okay. But for Peyronie's, it's actually the only really non-invasive treatment we currently have. And if you read the studies, there's a lot of, some studies will say it does have some effect on correcting the curvature. Certainly I can actually reduce the pain, because as the scar tissue is forming, some men will get quite a lot of pain in their penis. So we know that's effective, particularly for pain. Other studies will say that there's actually no effect on the curvature. But my experience, and again, it's always, working at the coalface and seeing many patients that you really start learning these things, is that there's a huge difference in presentation in men with Peyronie's disease. So you'll have some men who just have one small nodule, and therefore that will be very easy to treat. Some other men will have several nodules, or even some large plaques that can be up to 5 millimeters thickness. So I've seen some extreme cases that are not actually amenable to surgery. And even though I may explain to the patient that the shockwave therapy is unlikely to work because of the volume and density of the scar tissue, they still want to try, because there's no other option.
Because the alternative is surgery.
Exactly. And most of those patients are not actually candidates for surgery because of the extent of the scar tissue.
Wow. Peyronie's, I'm going to park that one on the side for a moment. But let's go back to libido, because you mentioned libido, and I guess the question is, what's normal? I mean, we all live in our own worlds and have our own images of what should be. How do we define normal libido?
Okay, so there's a huge, really spectrum of what could be considered normal, and so I get a lot of men who are worried because they seem to not have as much sex drive, which is the other term for libido, than say their friends, their male friends, and that's when I need to really explain to them this normal spectrum, which is really from not having a lot of libido, which is actually perfectly normal. And we talk about some men who are even, asexual, where their sex drive has always been very low, and you can't find any physical cause for that. So we know that some men just naturally have very low libido, and other men have extremely high libido. And there's everything in between. But again, we live in a very, I suppose, sexualized world to a large extent, the availability of pornography, and a lot of men feel that their libidos is abnormal because, again, they feel they're not interested as much as their friends. And so that's really the spectrum. So it's very hard to find something that's normal. In general, it's a change. Okay, so someone used to have a very high sex drive, and then there's a rapid change. Then you'd have to suspect that then that's when something's not normal. But the spectrum again is very wide.
Yeah. So it's the subjective assessment of the person saying, hey, I once was like this and now I'm not anymore.
Exactly.
What's going on?
Exactly.
Yeah. And what are some of the things that could be going on?
Okay. So interestingly, so if you look at younger men, often having low energy levels, so fatigue is an extremely common cause. Okay, we have good sex drive if you've got low energy or fatigue. And that makes sense in evolutionary terms. Why would we want to have sex drive and have babies if we're actually not fit to look after them? So that's how you could explain in evolutionary terms why that is. So chronic fatigue is a very, very common cause, and anxiety and depression are a very common cause. And again, you're not going to have good sex drive if you're extremely anxious, because that will cause, to activate, we call it the sympathetic system, which is what we activate when we get stressed, and that will close all the blood vessels that deliver blood to the penis. So in summary, in younger men, it's fatigue, anxiety, depression. And then in older men, it can actually be the fact that they start having erection difficulties, so they're not performing very well, and then they start getting what we call performance anxieties. They lose their erection, and then they start thinking, oh, well, what's the point in having sex since it's not, working very well? So that then starts leading to low libido. So I generally will ask in those men, actually, do you have erection difficulties? Often the answer will be yes, not always, of course, and I always ask, are you able to tell me what came first, the erection problems or the low libido? So of course, low libido can be caused by declining testosterone levels. In fact, it's one of the first signs of declining testosterone levels, together with low energy. So you can see how there's so many things that interplay here. And so it's always extremely important to check testosterone levels in those men. But as I explained to you, it's libido is far more than just testosterone. Okay? But the interesting thing in younger men, that's why it's always important to check testosterone levels even in younger men, because it's always, we always think, oh, well, a younger man is not going to have low testosterone. So it's often not checked. But in men who have severe anxiety, and I saw that actually around the time of global financial crisis, classic picture of men in their late 20s who were worried about losing their job, who were, in debt, etc. And in those men, measuring their testosterone levels was really incredible, because we would always expect a man's testosterone levels to be anywhere between 20 and 35 nanomoles per liter, and these men had levels as low as 4.
Wow. Okay.
So that's actually the effect, the response, what we call the pituitary gland in the brain, to stop producing this hormone called luteinizing hormone that stimulates the production of testosterone. Okay, so again, it's a natural response to a stressful environment.
So this is this stress response, which is often referred to as the HPA, the hypothalamus pituitary adrenal axis.
And there is the pituitary gonadal axis as well.
Right. So that then in turn affects a lot of hormones throughout the body. But sex hormones. So that's quite, from 20 to 35, whatever that figure, that
Yes.
measurement is, that's the normal range. And these young men were showing up as 4. And this was, as you were relating to, stressful situations. Wow.
Yes. And that's reversible. So, you remove the stress and the testosterone levels go up. Okay.
Wow.
Now, the other interesting thing actually about talking about libido and testosterone is that testosterone levels actually we've always said that testosterone levels decline in men with age. But we actually know it's one of the few functions that in a very healthy man, normal testosterone production keeps on, is still, normal into much later on in life. So yes, the testosterone levels in the male population are declining, but and the number one driver for that is actually being overweight and obese. That's the number one driver of declining testosterone in the male population. Why? Because visceral fat, which is the fat we accumulate inside the abdomen, converts testosterone to estrogen. So the more visceral fat you have, the more testosterone is taken and converted to estrogen. So in these men, you see testosterone levels declining and estrogen levels rising.
Right.
Okay?
Wow.
So that's something. So that's a very important, cause of low libido. It's classic, and of course, also a lot of older men do have issues with depression, and anxiety, of course, and obviously, sexual dysfunction, erectile dysfunction is a major, cause of low libido in older men. Because again, what's the point of trying to engage sexually with someone if it's not going to work anyway? So their interest in sex.
Declines. So okay, stress lowering, obesity lowering. We hear a lot about endocrine disrupting hormone, like hormones,
Yes.
plastics out there in the environment. I mean,
Yes.
I'm guessing that must be a factor too.
Well, I do talk to some of our patients about that. There's generally many other things that we can do anyway. And as I said, it's very rare that I see actually lean older men, actually. So we always start with the obvious, which is, the visceral fat loss. And most of my patients' testosterone levels start rising again. So it may take, 6 months, 12 months. But so just to show that we can maintain normal testosterone levels until later on in life. So, and testosterone is not just about sex drive. It's very important for muscle health. So maintaining our muscle mass, so maintain our physical independence later on. Very important for all tissues, really, brain function, bone health. Skin health, so it's an extremely important hormone.
How do we test for that? Is that a saliva test? Is it a blood test? What is it?
Okay, so there was a time maybe about 8-10 years ago when salivary testing and hormones became very popular. I personally don't do it anymore because I find that actually if you know how to interpret the blood test, you really get all the information you need. So we do a morning fasting testosterone level, and the patient needs to have fasted 12 hours. And there's endless information on this online, and it can be extremely confusing. I will always do as a screening test, a total testosterone, and that will already indicate to me whether there is already a lower testosterone than what you would expect. Okay, and then there's other things you can start checking. So you can start checking the free testosterone. You can start checking the proteins that carry testosterone in the blood, sex hormone binding globulin in particular, and also very important to check estrogen levels. So I check in particular serum estradiol. And
because if the estrogen's high, the testosterone's low?
Often there is that inverse relation, exactly.
Right.
Yeah.
Okay.
And I still will check DHEA in men, even though that's quite controversial in terms of
that's one of the omega-3.
No, so that's
or essential fatty.
It's actually. No, so that's DHA. So DHEA is actually one of the male hormones. It's produced in the cascade from cholesterol because we produce our androgens from cholesterol. down to testosterone and estrogen, DHEA.
Okay.
We're
not going to be testing on biochemistry here, but enough to say.
Yes, so it's a weak androgen, and it was thought at one time it was important to normalize the levels, but it's difficult because when you replace DHEA, it gets very quickly converted to estrone, which is a very potent estrogen. So there are issues there. So we really focus on the total testosterone, the free testosterone, and then the pituitary hormones called LH and FSH to try and get an understanding of what is causing low testosterone. Because, of course, you can also have damage to the testes and the cells that are producing testosterone. So that's what we call primary hypogonadism, so low production of testosterone. So that can be things like undescended testes, so babies who are born without the testes having descended into the scrotum, if that hasn't been corrected.
How common is that?
That's I know it's common. I can't give you a percentage, but certainly it's common now. These days that gets corrected, reasonably rapidly. Yeah. So then there's no damage to the testes, but you'll see some men who had delayed correction of that, and that can affect testosterone production. Trauma to the testes. Okay, so so that can be even from sport. Also, men who have radiation therapy to the pelvis, including for prostate cancer, that can also. Although these days it's so well, things have changed radically in the last 10 to 15 years with radiotherapy. But certainly, any radiation to that area, of course, can damage those cells.
So these tests, these are part of a blood test, really. I mean, you've got to know what to order. But in all the time that I've ever had a blood test done, now, Rob, I'm going to have to come and see you for sure, because I've never had that tested. And that's obviously quite, that's important. I mean, these are all issues that affect many of us.
Yes. So, I mean, to answer your question, why often this doesn't get checked is, and this is when I come back to, having said that I have extended my practice to integrative medicine. So that's when we really put all the pieces of the puzzle together. And that's very different to how our medical system has evolved, over time, where we, particularly since World War II, our enthusiasm for science and pharmaceutical medicine really led us to believe that we could really solve all problems through pharmaceutical drugs that are really there to block certain things from happening. And then today there's so many people do have more and more health problems, and that's in part due to the rise in body fat, as we said earlier. So yes. So coming back to the integrative approach, that's different to the pharmaceutical approach in the sense that we actually look for the cause of the problem. Okay, so when I started doing health checks, that was at Sydney Men's Health in Bondi Junction. So this is going back 2005, because I had an interest in preventive medicine then already. You start realizing, well, we're actually never taught how to do a health check and a preventive health check, which you do, because generally when you request for a health check, if you go to your GP and ask for a health check, and it's not just GPs, but generally it will be, the standard blood sugar, cholesterol, have your blood pressure checked. But the more I've learned about preventive medicine and health checks, I check a huge number of things, and including testosterone and estrogen levels. Even in younger men, because testosterone levels are actually a really good surrogate marker of health, because basically any stress on the body, whether physical or emotional, is a good way of summarizing, will cause testosterone levels to decline. Okay. So if I see a 25-year-old who has a level of about 15, as opposed to what we said about, what we'd expect most men to be between 20 and 35, I'll say, look, something's going on here, let's have a look. Whereas we've had a tendency in medicine to say, well, look, we just wait for things to break before we go and look for the problem or check these things, okay? Yeah. And I think also with testosterone, there's been a big lack of understanding. It's really only, again, in the last 15 years, we've really taken interest in testosterone in men, which is pretty incredible. And so I've actually was lucky to grow with that knowledge, okay? And hence it's But unfortunately, what you read on the internet is still very much, a few years behind, and that's why people get really quite confused about it all. But certainly, it's a very, very important hormone to check. And doesn't. Sorry, I was just going to mention in terms of the estrogen levels as well. What is interesting when you see the estrogen levels start to rise. So again, number one cause is rising visceral fat levels. Is that estrogen actually can also cause the prostate, is probably one of the major drivers of the prostate gland to start enlarging. Okay, so then again, there's a correlation between being overweight and the onset of an enlarging prostate, which will often then lead to increased frequency and getting up more often at night to urinate. So all these things,
which is a good segue into my next question, which was related to prostate. And before we embark on what some of the problems are, what is the prostate for?
Okay, so very interesting question, because I would say that 99% of my patients have no idea what it does. It's always a conversation I have, because with the comprehensive health check, I always ask about urinary symptoms. And for men, important to start doing a prostate check from some men from 40, others from 45. But again, they have no idea what it is. So it is actually, it has three main functions. It's an endocrine gland, which is interesting because it actually is the main organ that converts testosterone to dihydrotestosterone. So about 4% of our testosterone gets converted to dihydrotestosterone, and that's a very potent androgen, so a very potent male hormone. And it also has a role in fertility and reproduction, because the fluid it produces actually is designed to protect sperm in the vagina. So there is a fertility side to it as well. And also sexual, because during orgasm, the prostate contracts and contributes to sexual pleasure. So a very important gland. And again, there's a very little understanding and knowledge of it.
And so what are some of the issues that men face with their prostates?
So in younger men, a very common problem is an infection occurring in the prostate. Now, when I say very common, you have to distinguish what we call acute prostatitis and chronic prostatitis. So acute prostatitis can be, for instance, a sexually transmitted infection such as chlamydia or gonorrhea that actually gets into the prostate and causes an infection and a strong inflammatory response, and that's quite a dramatic picture. But much more common is what we call chronic prostatitis, which is much more subtle onset, and I'm seeing again younger and younger men who have this, and of course in older men it's particularly common, where we think it's probably starts with a low-grade infection that can be is probably transmitted through unprotected intercourse. Okay, so there are all sorts of bacteria we know that can actually lead to this low-grade infection. It can be bacteria such as Enterococcus that can cause surprisingly low-grade infections in the prostate, and that's because it's a gut bacteria. And of course, there's a lot of gut bacteria in the area of, say, around the anal vaginal area. And so that will often present with subtle signs such as increased frequency, sometimes
of urination,
excuse me, and some dull pain that they feel somewhere in their pelvis or in the perineum, which is the area between the scrotum and the anus, and sometimes it resolves spontaneously. And that's why I'm saying it's very common, because I ask men about all these, whether they've had these issues in the past, and a lot of men will say they have. So hence why it's a lot more common than what we actually realize in younger men. And then in some other men, the problem will actually just get gradually worse over a number of years. And it can actually, even in some men, in extreme cases, ruin their lives because the pain becomes so severe, the urinary frequency is so severe, the urgency is a real problem. So they suddenly, that urge to urinate, when that urge comes, is irresistible. They need to get to the toilet very quickly. Yeah. So, and you can also get, there's all sorts of other symptoms. You can get, a feeling of discomfort in the shaft of the penis or at the tip of the penis. Sometimes you can get some discomfort in the medial aspect of the thigh. Sometimes it can radiate to the lower back. And as I said, a lot of people live with this condition when it's mild. But as soon as it starts getting more pronounced, particularly with the pain and the urinary frequency, those are the men that I tend to see in my practice, and they tend to find me by doing a search on the internet. That seems to be the way they find me for this in particular, because prostatitis, as we call it, so chronic prostatitis is often referred to as simply prostatitis, is probably one of the most poorly treated conditions in men. And urologists don't particularly like dealing with prostatitis, because it really is more a medical condition in the sense there's no really operation you can do, and urologists tend to be extremely busy everywhere in Australia, and so prostatitis tends to be initially treated with antibiotics blindly, and if the patient doesn't get better after a 4-week treatment of antibiotics, that 4-week treatment may be repeated, and if there's no improvement, generally they're told that there's nothing more that can be done. So I often see men who have been unable to find anyone to help them. Now, it really is a multi-dimensional problem, in the sense that there are many predisposing factors to getting this condition, which again, in my opinion, if you can't isolate bacteria in the urine, doesn't mean that it wasn't initially triggered by an infection. Now, some of the predisposing factors that are going to make you more likely to get ongoing problems with this is pelvic floor problems. Okay, so that's become a big understanding in the causes and aggravating factors in prostatitis is having either your pelvic floor muscles, which again are those that are in our pelvis that if you want contain all the pelvic organs or contain the you can think of it a bit like a salad bowl you put in the
holding it all, intoning it up,
exactly,
keeping it in place, functioning properly.
So really the key to the treatment of prostatitis, again, to relieve this pain, this frequency, is really having a pelvic floor assessment, because you can either have an overcontraction of these muscles, in which case you can even that can even lead to the prostate actually being pushed up into the base of the bladder, which can explain why a lot of these men will get the frequency and the urgency. Right. But also that means that the prostate is not able to drain properly. Okay, so in my opinion, it's a very strong contributing factor, because it's an organ that produces fluid, as we said earlier.
Yeah. Would that overcontraction be a response to trauma in that area? It could be like a muscle tightening and being traumatized.
Okay, so again, it's a really fascinating story, because in fact, probably one of the number one causes is stress, anxiety. Because the more anxious we are, the less we tend to breathe properly. Okay, so it's what we talk about, developing what we call apical breathing. So we actually don't even lower our diaphragm anymore, and in our busy lives and stressful city lives, we tend not to breathe properly anymore. And when we don't breathe properly, fill our lungs with air, lower the diaphragm. When we lower the diaphragm, our pelvic floor muscles relax. Okay, so if you're never breathing properly, your pelvic floor will start becoming, we call this the hypertonicity, so they become hypercontracted. And that's a very, very important cause of problems, again, in with men's prostate and triggering urinary problems. But it can also contribute to erection difficulties, because you're also blocking off part of the blood supply, because obviously you're causing pressure against very important arteries. And then you can also have the muscles that are not contracted enough, so we call hypertonicity, and that can happen from prolonged sitting. Okay, so again, with our sedentary lifestyle, very, very common, and you often notice people who have prostatitis and these symptoms we talked about, they'll say they often get worse after periods of prolonged sitting. Okay, so either long car journey or having sat down at work all day. So I work in close collaboration with a men's health physiotherapist. There are a few around. There are very few who are actually truly specialized in men's health and are actually experts at pelvic floor. And that's been extremely valuable collaboration, because you cannot really get successful outcomes with prostatitis unless you've actually looked at what the pelvic floor is doing. And of course, there are all sorts of techniques to then help the muscles either, improve the tonicity if there was if there were muscles were too relaxed, or and again help muscles that are too contracted, pelvic floor muscles that are too contracted, to help them relax. And that's often through breathing exercises.
Wow. Now, you've just hit on so many topics that we've covered on this podcast before, but we've never related them to men's health and prostate health. Fantastic. And as somebody who's gone through, prostate cancer, and I'll talk about that in a moment, I want to ask you about it. I have had the experience of that physiotherapy that you're discussing, and the importance of those exercises post prostate cancer treatment. But we're going to get onto that. This is fantastic. And that breathing, and anyway, great stuff, Rob. I'm learning so much here. It's fabulous. Now testosterone, okay, so a function of stress, a function of, the prostatitis. What about enlarged prostate? So, I mean, when we move, is that a follow-on from being inflamed for too long?
So generally, the enlarged prostate, so what we call benign prostatic enlargement or hypertrophy, BPE or BPH, yes, is another very common problem with the prostate. Now, as I mentioned earlier, probably one of the major drivers is excess estrogen levels stimulating the growth of the prostate. And interestingly, a lot of men who have prostatitis also have this enlarged prostate, because as this prostate enlarges, its architecture changes slightly, and again, in my opinion, probably it impacts on drainage, and therefore an organ that doesn't drain properly is more likely to start having some inflammation there, and if you have a few bacteria there, that again will predispose them to, or will favor a low-grade infection to be unable to resolve itself. So this enlargement of the prostate is very common. I mean, we say generally about 40% of men in their 40s will start noticing some change in their urination. So that is, increased frequency or the flow of the urine. The urine flow is not as strong as it used to be. And again, getting up to urinate at night once to twice is considered normal. These men will start noticing they're getting up more frequently, or if they didn't get up at all in the past, they start then having to get up. So benign BPH, benign prostatic hyperplasia, is an extremely common condition, and it's one of the conditions that urologists do treat, can treat very effectively once the prostate has got to such a size that men are having really extreme voiding difficulties. Now, when I see a patient who presents with these urinary problems we've just mentioned and an enlarged prostate, now the way we diagnose that and I do that in my practice is really through something that most men would not want to have, is a digital rectal examination, which actually, in my view, is one of the reasons why a lot of men put off their health checks. Yes. There's a fear of having that done. Okay, but hopefully we'll have very cheap ultrasound machines one day. We can actually do that through an ultrasound in the practice without having to do a rectal examination in terms of assessing the size. But
so just for those that have missed it, the digital rectal examination is going.
Yeah, so with a gloved hand, you insert the right index through the anus, through the anal canal, up into the rectum, and you can actually feel the back of the prostate up against the wall of the rectum.
Yeah. Okay. And men should be having that. Well, when from?
Okay, so again, there's no consensus around the world about this. Just like there's really important for the listeners to understand, there's very little consensus about a lot of things. Okay, like there's also, we're getting more towards a consensus about what is a normal testosterone level, what is testosterone deficiency versus what is not. But that's fairly, we're finally getting there. But for this, I think a good rule is if you do have a family history of prostate cancer, particularly if your first degree relative, whether that be maybe your father had prostate cancer at the age of less than 55 years of age, then definitely screening should start at age 40. And if you don't have a strong family history of prostate cancer, then I would definitely start at 45. Now, the advantage also of starting to check the prostate from age 40 and 45 is that through this examination, of course, what you look for is a change in the consistency of the prostate, whether it's no longer symmetrical, whether you feel any nodules. But I also do it to be able to see whether the man's prostate has started to enlarge, whether to see they've already had this onset of this benign, this BPH. Because if they have, I'll say, look, if you're not careful, in 5 to 10, 15 years, you may start having urinary problems. You may have then to have a prostate operation. Obviously not as dramatic as a radical prostatectomy, which is remove the whole prostate, but still quite traumatic, usually a TURP, T-U-R-P, transurethral resection of the prostate. So it's another galvanizer, I think, to encourage men to start losing weight. Because again, I have seen that another correlation. Usually it's very uncommon for lean men to have an enlarged prostate. It does happen, absolutely. Those are usually men who have high insulin levels, because we think insulin is also a hormone that stimulates the growth of the prostate. So it's another reason why I always encourage men to have a prostate examination. I say, look, yes, prostate cancer obviously is very important, but let's not forget to check whether your prostate has started to enlarge. Okay? Because we think as well as the prostate is enlarging, there's more cells dividing, so that will increase. We know that it's also an increased risk for prostate cancer further down the track. But we were talking about prostatitis, and then we now know that prostatitis also increases the risk of getting prostate cancer, because you've got chronic inflammation in organ. Any organ when there's chronic inflammation is at higher risk of cancer developing in that tissue.
You mentioned your integrative approach, which is something that I know will sit very comfortably with a lot of our listeners. And I know you're interested in gut health. We've talked about gut health in many other ways. But tell us about gut health and men's health, and you've identified some of the issues. Go on, tell us what you see as the connections there.
Yes. So my interest in gut health started when I started doing health checks, because every second to third man I was seeing for a health check would tell me they were having gut problems. Okay, so whether that be bloating, discomfort, a lot of flatulence, constipation, diarrhea. So, generally look for a cause of that. Maybe quite simple, but in men who are 45 or older, we were always taught to say, well, look, you have to really start being careful about the possibility of maybe bowel cancer being present, or maybe an autoimmune bowel condition, like inflammatory bowel disease. So I'd typically refer those men to a gastroenterologist I work closely with, just down the street from where we were at Sydney Men's Health. And often these patients would come back to me after having had a colonoscopy, sometimes with a gastroscopy. And they would say that, well, I've been told there's nothing wrong. They've got probably some IBS, and that's it. And so these men would look at me and say, okay, well, Rob, what do we do? And I would say, well, what do you mean, what do we do? I've just sent you to the gut expert. So that was my first realization that there was something really missing in our understanding of gut problems. And it was just the time when we started talking about the gut microbiome. So again, probably going back about 13 years ago. And so a bit like testosterone, I managed to get onto that knowledge, that explosion in knowledge back when it all started. And I always had an interest in microbiology anyway. And coming back to actually prostatitis, you see, I'd always heard that there was an association between men who had prostatitis and IBS, as we have.
Irritable bowel syndrome.
Correct.
Yep.
Which is generally the term we give to people who've got gut symptoms the way we've described, but have got no abnormalities seen on colonoscopy or gastroscopy, and all their biopsies are normal. Okay, so that's the general label we put. Basically, we're not quite sure what's going on, but there doesn't seem to be anything to worry about.
This is probably a good spot to just say that you mentioned the urologist and you mentioned the gastroenterologist, and unless there is something very obvious and serious that they can operate on, then patients are often dismissed as there's no problem.
That's right.
Please continue. Because that's true, isn't it? I mean, that happens a lot.
Unfortunately, yes. Yeah. So over the last, particularly the last 8 years, I've developed a very good knowledge and understanding about the gut microbiome. Now, to such an extent that it is one of my areas of interest, and so I've actually also put that on my website. It's one of my areas of interest, and that's been probably the fastest growing part of my practice, is men coming to see me with all sorts of different problems. So either because they've had, again, the constipation, the diarrhea, the bloating that no one is able to help them with, but also people with severe eczema, autoimmune diseases, because we know now that the gut is the core organ in our body that drives a lot of disease. Okay, so by rebalancing the gut microbiome, and the way you do that currently there are different tests that you can do to look at the population of bacteria in the gut. There are some people in Australia who send stool samples to the US for a technique called PCR testing. Unfortunately, they still remain very unreliable. You can send a stool sample to 10 different laboratories and get 10 different reports. Mm-hmm. So currently, in Australia, we have a laboratory in Melbourne that's been working on for 30 years on gut bacteria, and they are using the culture method, which has its limitations, but it's already a fantastic tool that we can use to already look at some of the core families of bacteria in the gut and the imbalances that are present, and really to make this probably easier for our listeners. So it's a test that takes about 2 to 3 weeks, because some of these bacteria are very slow to grow in the laboratory. And then it would involve rebalancing these gut bacteria through really supporting or giving probiotics for those bacteria that are lacking, and giving some what we call antimicrobials. So sometimes I give a short course of antibiotics, surprisingly, but when you've got some overgrowth of certain bacteria that we know cause problems, it's a very effective way of treating, giving a short course of antibiotic, because you actually know what you're targeting with minimal collateral damage. And that generally is a 4-week core program, if you want, and also a lot of nutritional advice to inform, so it's all about, we tend to forget that we're not just feeding ourselves when we eat, we're actually feeding 40 trillion bacteria in our gut. And so our nutrition, and it puts a whole new dimension on nutrition, because I'm able to give some advice on what people need to eat in order to either stimulate the growth of certain bacteria or remove certain foods that are actually stimulating the growth of unfavorable bacteria. And so by doing that, because we know that 70%, at least 70% of the immune system is in the gut, because that's the greatest boundary between the outside world and the inside of our body, as far as obviously the lungs is also a big boundary, but that's air. We're talking about this boundary where we put, again, food that gets digested and then needs to get absorbed. So that explains why so much of the immune system is there, to keep an eye on what's coming in, okay, and what is being absorbed into the body from the gut. So that has led me to treat actually a whole range of problems. So as I said, some eczema is a reasonably common one, very tricky condition to address, but it definitely does help a lot. The problems often you see people who've had these conditions for many years, so the longer they've had a health problem, the longer it takes to improve the situation. If you had a problem for 10 to 20 years, it would only make sense if you're, to rebalance something like the gut. It would take, sometimes a year or a bit longer for things to go back to, to improve conditions like eczema. But often people who don't have those conditions, who have very, very troublesome, problems such as, again, the constipation, the diarrhea, can get really rapid improvement from the treatment.
It's interesting because and it's also referred to as the second brain. So the impact of that, food, gut health, on mental health is quite profound as well. And no doubt affecting prostate and all of these other health issues that you're trying to bring back under control.
Yes. So actually talking about integrative approach, so when I was saying that pelvic floor problems and addressing them is actually key to the success, in some men who have severe gut issues, we know their prostatitis is never going to get any better if we don't address their gut problem. So, for instance, the physiotherapist I work with, he will identify people who have severe gut problems. They're very obvious, and will refer them to me to work on their gut, and then vice versa. I'll send people to him to deal with the pelvic floor. So there's even that issue that the gut microbiome even has a role, as I said, for specific men's health conditions such as prostatitis. So it's really interesting. Yeah. Now, also for mental health, we know that some changes in the bacteria associated with mental health problems. So you have some bacteria, particularly E. coli, very important in producing some synthesizing, making essential amino acids, which are precursors to important hormones, neurotransmitters such as dopamine and serotonin. And then we know that the overgrowth of certain bacteria such as Streptococcus and Enterococcus produce a lot of D-lactic acid, which can have some profound effect on some people's brains.
Yeah. Well, we did a program a few weeks ago with a pediatrician talking about pandas, which is the Streptococcus. It's a pediatric infection of Streptococcus, dramatically affecting a person's behavior. Like they could wake up the next morning and be OCD, obsessive compulsive disorder. But let's move on just to prostate cancer, because, this is something that I personally it's happened to me. I got a diagnosis of prostate cancer 3 years ago. Tell me you've mentioned all the things that people should be looking out for in prostate health, and presumably they are things that should alert people to the possibility of it being even prostate cancer. What are some of the challenges? In terms of treatment options for prostate cancer, some of them have effect. Not some of them. They have an effect on sexual health, don't they?
Absolutely.
Yeah. What are some of those challenges?
Okay, so all men after one of the most common procedures for the treatment of prostate cancer is what we call radical prostatectomy. So removing the whole prostate gland, the seminal vesicles, and even though the surgical techniques have improved dramatically, unfortunately, losing one's erections is still currently an unavoidable consequence of having a radical prostatectomy. However, the techniques now preserve the nerves that actually travel around the prostate gland, which is why probably 15 years ago, radical prostatectomies cause a lot of damage to those nerves. So now they do what they call nerve preservation, but there will still be some stretching of those nerves during the operation, which explains why men will 99.5% of the time will have no erections after the operation. So now with radiotherapy, that tends to be usually a delayed onset of erection problems, but I tend to see a lot more men who've had radical prostatectomies. So I will see some of those men for what we call sexual rehabilitation after prostate cancer operation, or penile rehabilitation, and that's essentially helping the penis, the tissues in the penis remain healthy enough so to give times for the nerves to heal themselves. It's when you damage or you stretch the nerves, it's a process called, pathological process called neuropraxia. So you give times for those nerves to heal. And what you do classically is you'll give some medication, such as commonly Cialis or Viagra, which do help increase, even if they're not going to give an erection, they do increase a little bit the blood flow into the penis. And if after 6 weeks after the operation, they're not getting any sort of erectile response from the medication, then you'll start them on some injections, okay, where I actually teach men how to give themselves an injection into the penis, which sounds horrendous, but it's actually not as bad as it sounds. Mm-hmm. And that's very important because that will give the man some erections. So you're trying to get blood flow into the penis, because obviously you have to always think of the flaccid penis as being an organ in a relative state of, nutritional and oxygen deficiency. So you're trying to create these artificial erections so you actually get some nutrition to the penis, and that's how you actually maintain the health of the penile tissue whilst you're waiting again for the nerves to heal themselves. So
what are they injecting?
Okay, so the compound is called alprostadil, or prostaglandin E1. And it works in a similar way to, say, the better known compounds, drugs such as Viagra or Cialis. So now the advantage of doing that is that also will enable the man to have sexual intercourse if they wish to. So that's a real benefit of doing.
Right. So that is within 6 or 8 weeks of the operation.
Correct.
Wow.
Yeah, and the sooner you start, the better the outcome. In terms of recovering sexual function, it can take anything up to 3 years, but it's generally 12, 18 months, up to often up to 2 years. And again, the more the earlier the man has started, the more likely the recovery is. Now, that very much depends on what their erectile function was before the operation. So if they had very good erectile function, so the ability to get erections before all the prostate cancer problems start in the operation, then they have very good chance of recovering. They will often still need some support with medications such as Cialis, Viagra. Others will often need to have those injections lifelong in order to achieve an erection that's hard enough for intercourse, if that's what the patient wants. But the whole issue of sexuality after prostate cancer operation is obviously very big, because there's loss of that sexual intimacy, and often men get so traumatized by the whole experience that
it is a very challenging time. I can that's for sure. But tell me, if we've covered so much here, if you had to leave our listener with, here we are as men listening to this, and partners of men listening to this, and saying this is what men should be doing to ensure their health is as good as it can be. What would be a couple of tips that you would leave our listener with?
Well, certainly I say to all the men I see who are lean, I say do never put on weight, okay? Because that's probably your greatest the most important aspect of your health. And often that means that it doesn't necessarily mean they're going to have good nutrition, but that often, will make them focus on their nutrition. And we know that nutrition is also key, obviously, to good health. And we know that good physical activity is very important. But the thing I really want to emphasize, and this is not to encourage people to come and see me in particular for a health check, but probably one of the biggest misunderstandings out there is that we can support all our nutrition through diet alone. And this comes back to gut health, you see, because again, like all other tissues, our gut starts to age from, about the age of 40. And if you actually look at the process of digestion and absorption of food, it's highly complex. And so it only makes sense that as we get older, the ability of our gut and our bacteria and our digestive enzymes to extract the nutrients from our food and actually absorb them starts to decline. So in fact, nutritional deficiencies become very common from the age of 35 and 40, because in fact, the big misunderstanding out there is that we can actually maintain good nutrition through diet alone. And that is absolutely correct until we're 35 or 40. But I always remind everyone that in evolutionary terms, most of us didn't live past the age of 40 until not that long ago. So these didn't used to be problems. But now that most of us are living, into very, much later on in life, you can really improve quality of life by optimizing nutrition. And by that, I mean that, for instance, my health check, I'll check for mineral deficiencies, vitamin deficiencies, and the hormonal deficiencies, and particularly seeing what the testosterone is doing. And to actually correct those deficiencies, they're extremely common. Vitamin B12 deficiency in particular is probably one of the most, we call that a hidden epidemic in integrative medicine, because so many people are deficient in B12 and don't know it, because unfortunately the problem is that we rely still too much on what is given to us by the pathologists, which is called the reference range. Now, really what the reference range tells us in most cases is where 97% of the population sits. But we know that 97% of the population is not healthy, and therefore the actually comparing one's level to that reference range has actually become obsolete. And we know in nutritional medicine where those optimal targets are, and that's what we need to aim, to encourage patients to achieve that. So, for instance, a lot of my patients will be on vitamin B12 supplementation. Certainly vitamin D is a big issue as well. Now, also around the age of 40, the ability of our skin to produce vitamin D when exposed to UV light starts to decline. So hence why usually, so I'd say 90% of my men above the age of 45 are on vitamin D supplementation. Not everyone, but most. Why? Because the ability, again, our vitamin D levels decline naturally. And there's also very little awareness of that out there. So hence, that's always an example I give of why supplementation becomes really important, because you're helping or giving your body certain nutrients, and in this case, vitamin D, because, when it's no longer able to produce it itself. So of course, we don't die overnight by starting having these deficiencies, but it accelerates the aging process.
Look, I just want to finish with one last question, and this is taking a step back from your position in men's health, because we're all patients, we're all out there doing the best we can. What do you think people's biggest challenge is on their health journey through life in our modern world today? What do you think that is?
So I think lack of physical activity, I still feel very depressed that our cities keep on still moving outwards, and people using, their cars to travel. So I think lack of physical activity is a big challenge, because people are encouraged to commute long distances and sitting in their cars for very long hours, or commuting on trains. But also, I think the quality, and also eating the right foods. I think for me, I tend to realize that we live in what we call an obesogenic world and environment. Everywhere you look, you see food, okay? And I think it's getting very hard for people to resist that temptation, because, it's particularly in the city of Sydney. As I said, you go out at lunchtime, there's coffee carts with cakes and, food stalls and food courts, and everywhere you look, again, you're constantly encouraged to eat. So I think personally that is a very big challenge, but also the quality of our food. Again, I always remind everyone we don't grow our own food, even though it looks fantastic on a plate. I believe that our food is becoming more nutritionally deficient, despite what agribusiness may say about that. And that's something that people again don't realize, that I think our food is very nutritionally deficient. And since we're talking a little bit earlier about environmental issues and plastics, I believe, air pollution is finally now being recognized more and more as a major factor in our health. We know that air pollution is related to cardiovascular disease, all these microparticles that we absorb, and, lung cancer is, the incidence of lung cancer is rising. We hear more and more of people who get lung cancer who have never smoked. Okay, it's a very common story you hear out there. So I think living in a city is a big challenge. I would love myself to live out in the country, grow my own food, breathe clean air, and but the reality of work and where our job and career opportunities are in the cities, and so I think that's probably one of the challenges. And stress, working very long hours. Yeah. Okay, so I think yes, I mean, the cost, as we know, of everything is very high, and getting one's, having a home where we can live in is extremely expensive. And so some people, work very hard to achieve that now. And that's certainly high stress levels, as I think you've spoken about in the past, is extremely detrimental to our health.
Mm. Rob, thank you so much. That was just fantastic. I've learned so much. Thank you for joining me.
Thank you very much, Ron.
Wow. So much in this episode. It's why I love doing this podcast. I learned so much. I hope you do too. Testosterone. Now, in all the years I've been getting blood tests, it's never been tested. Peyronie's. Never heard of that, at least as a disease, and 10% of men. Of course, the issue of prostate cancer is something I am sadly very familiar with. And it's been fascinating for me in my surgery, in my practice, talking to patients, to hear the various stories from various men. Not to mention talking about it with family and friends. It's very challenging. It's a very challenge, particularly if you go for treatments, surgeries and radiation, treatments always come with complications. So it's very challenging, and it's something that is important to be able to talk about. Men can easily climb into the cave and not express how they're feeling, and it can get very complicated. Again, I'm putting my hand up here too. Urinary incontinence, erectile dysfunction are both things that strike at the heart of our own perception of ourselves, but it's also something that affects many people, surprisingly, as we get older. But what about stress affecting testosterone levels? Well, breathing problems affecting pelvic floor, which in turn affects prostate, erectile function, and urinary problems. It's why breathing is a pillar of health on its own. But there's a few extra things that I need to add to my understanding of the importance of breathing. And what about prolonged sitting? The sitting, we've heard the expression, sitting is the new smoking. And this whole idea of making pelvic floor pelvic floor muscles too loose. So, this is all tying in really amazingly with all these 5 pillars and 5 stress model. So prostates are an issue for all men, young and old, so do not ignore it. We'll have links to Dr. Rob King's website, and we're going to do some more stories on men's health. So, until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner.